Broadly, we classify lenses in two categories. One we call multifocal lenses, second we call monofocal lenses. By monofocal lenses, we advise that patient would be able to carry out his distance activities without glasses, and they would require glasses to be worn for reading. If this would be possible if they undergo uh, monofocal lens implantation. If they choose to undergo multifocal implantation lens, then patient can have a good distance and near work without the need of glasses. Most of the time. If it's a very small thing, fine print like reading share market prices in newspaper or reading the MRP on a tablet counterfoil, then they would still require glasses. But 90% of their near vision will be taken care of with a multifocal lenses. So the decision to which lens would be better is two-way. One is medically, second is patient point of view. Uh, to implant a multifocal lens, the first criteria is the eye undergoing surgery at that point of time should not have any other illness apart from cataract, because the multifocal lenses perform best when eye is otherwise healthy. So before choosing the lens for the patient undergoes a series of tests. वहाँ पे we take the lens measurements, we scan the retina of the patient, we scan the nerve of the patient, we check for dryness for the patient's eye, and once the eye is found to be fit, I mean the eye is found to be normal, then the next step would be to evaluate the patient's lifestyle, because if a patient nowadays we all are spending more time on gadgets, we all have more of screen time, and in the past there would be two categories of work. One is distance, other is near. Now we have something we call as intermediate work. By intermediate, typically near work involves work which is at around 1 feet, which would include reading, writing, which would include mobile usage. But nowadays, as I said, we have more of intermediate work, which is typically at a distance of 2 feet. That includes work like working on a desktop or a laptop, uh, seeing dashboard while driving a four-wheeler, for females working against tawa or a gas against intermediate work. So post-COVID, we are seeing surge in increase in our time spent for intermediate. So to combat that, we have. I mean, if a patient chooses, just like in glasses, we have two varieties: bifocal and progressive. In lenses, we have two varieties: multifocal and monofocal. So patients who are active on gadgets and have healthy eye can definitely a candidate for a implantation of multifocal lenses.